Great. Hello, everybody. So my name's Julie Mytton. I'm the Director of the Child Injury Prevention and Injury Care HIT. And what I thought I'd do today is just share with you, in the first couple of slides, some of the breadth of projects that we're trying to include in our HIT. Well, I think one of the challenges for the Child Injury and Prevention and Care HIT is that actually we're looking at a very broad topic. So I thought I'd just give you an illustration of some of those, some of that breadth. So we have a number of different clinical themes within the HIT, one of which is burns and scalds. And the burns and scalds work has been very successful because it's underpinned by an external research grant from the Children's Burns Research Centre funded by the Healing Foundation, which is a national charity. And we've got a prevention, a care and a rehabilitation theme within that Children's Burns Research Centre. But to give you a flavour of the types of projects that are going on, we've got a study that's funded by the National Institute for Health Research looking at low friction sheets to try to improve wound healing in children that have had burns. We've got some work going on to develop smart dressings. So when children have burn wounds, you don't want to have to keep changing their dressings because that disturbs the healing wound. And one of the challenges is knowing whether or not your wounds are infected. So these are special dressings that are going to change colour if there's infection going on within the wound underneath the dressing. So very exciting work, potentially very transferable to other areas as well if we can get that one going. And the MYSTIC study was a study looking at how do children normally respond to a burn. So we know that children actually often get fevers after burns, but it's not clear whether the fever is just a normal physiological response to having a burn or whether it's actually a marker of infection. So things like that. So this is very clinically led, but been a very productive work stream. Another one that's been quite interesting is head injuries. Large numbers of children present to Children's Emergency Department with head injuries every year, most of them really minor, but some of those children don't do as well after the burn, after the head injury than others do. Some of them get what seems to be a post-concussion syndrome, even after a relatively minor minor head injury. So there's some work that's funded by RCF funding to look at developing an intervention for parents of young children that have had a head injury. How can those parents help spot those early signs of post-concussion syndrome and manage them appropriately? And then actually, for older children, if you've got them, those symptoms, if you spot those symptoms, what should we be doing about it? How should we be advising parents? So another stream of work that's going on around that. Another big event that happened in the last 12 months was that we had a conference at University Hospital's Bristol Education Centre. This was our third conference that we've held under the banner of the HIT. We called it Making It Happen, Child Injury Prevention and Care. It was all about trying to be very practitioner focused. It was about thinking about what's going on in the front line with regards to prevention, injury and rehab. We were quite pleased. We got quite a few students along to that conference, from nursing students, paramedic students, and we felt that actually we'd engaged much better previously with some of those audiences. And two other little projects which I think are quite interesting. Has anybody here heard of AirHop? Has anybody been to AirHop? Okay, so if you don't know, AirHop brands itself as being, I think it's the world's biggest trampoline park. It's this huge warehouse that has a floor full of trampolines. And the emergency department team at the Children's Hospital were really, really anxious about this opening in Bristol because they know that every summer they get large numbers of children coming into the emergency department with trampoline-related injuries that have happened in their own trampolines at home. Now, so they've been doing a little bit of monitoring, and what they found is that they haven't had this huge surge of injuries. And so what they're now thinking is, okay, what are AirHop doing well? We need to work with AirHop now to actually understand how are they actually having this huge number of people enjoying this lovely form of physical activity without getting injured, and how can we then translate that into messages for the public to keep their children safe at home? So that's interesting, actually. It's not gone the way it was originally thought to go, and that's quite interesting. And another thing we've done is there's been quite a lot of work looking at an in-hospital care pathway for open tibial fractures in children, which are very complicated, nasty injuries that can lead to long-term disability. I wanted to give you some information about a new grant that we've recently got and the reason why I think we got this grant, which is very clearly related to the Bristol Health Partners and the HIT model. So just before Christmas, we were commissioned by the British Red Cross to do some work for them, trying to identify which population groups could potentially benefit from first aid education. Now, the Red Cross's definition of first aid education is actually quite broad. It's about self-management, not just CPR and trauma care. But they want to know what population groups should they be working with to develop some targeted support materials to help people make the right decision about when to seek care from emergency departments. And the CIPIC HIT got together with the Ithaca HIT, the Avoiding Hospital Admissions HIT, and we put in a joint bid. And we profiled Bristol Health Partners quite clearly in our bid. And when we were at our interview, the first question we got asked was, tell us about this partnership that's going on in Bristol. So I think one of the reasons we won this award was because we were able to demonstrate that we've got a really joined up way of working across institutions and organisations in the city. And I thought that was a really important thing to share with you because you might want to do the same thing if you're doing bids for funding in the future. It seemed to be quite influential in the decision. So we've got 10 months of funding. It's a very short project, but we're going to do a range of qualitative and survey methods to try to help give the Red Cross some indications of where this programme of work could progress in the future. I was asked to talk about challenges as well, and I think for our HIT in particular, our clearest, biggest challenge has been the capacity of our clinical colleagues to contribute to the HIT in addition to their service demands on their time from their service commitments. Those that have been able to commit are the ones that are actually already got mechanisms for buying out sessions or they've already got funding to do projects and they can actually commit to doing some specific pieces of work. Those that are actually purely service led with their work streams are finding it much harder. We've been going for 3 years now, our HIT, and we've got a strategic review of our HIT happening on Wednesday week. And I think that's really important because it's going to be a really good opportunity for us to look at what we have achieved and what we haven't achieved out of our original aims and think about, does this mean we need to be doing things slightly differently in the future? So I think that'll be helpful, and we need to do a bit of good reflection about how we continue. So I think our future depends on the outcomes of that strategic review. And I think another thing that's going to be very important for determining our future direction is we're going to be doing some work with Bristol City Council Public Health team. They're about to initiate a needs assessment on child injury in the city. And I think that will hopefully provide the direction that we need in order to help plan our work for the future. So that actually is all I wanted to say. So I think I'm within time. Excellent.